Now there are some factors that affect the dried blood spot method validation, like hematocrit. I already discussed about hematocrit volume, hematocrit value. Hematocrit value is the volume of red blood cells present in the blood. So if there is higher hematocrit value, so the blood spot will be viscous, and there will be issues of like hematocrit value has influence on the blood to plasma ratio. Hematocrit value will be higher, then there will be higher viscosity of the dry blood spot. So it actually hematocrit value affects the spot formation, spot volume, spot drying, and recovery rate. Main problem is recovery of drug of interest. If there is higher value of hematocrit, there will be low rate of recovery of drug of interest. If there is low value of hematocrit, there will be high rate of recovery of drug of interest. So also there is like hematocrit value actually affects the spot size and reproducibility, homogeneity, uniformity of the drug. Like if there is higher value of hematocrit, the drug of interest will not be uniform in the blood spot. It will be irregular. There will be no any uniformity or homogeneity. So there is issue of extraction, late extraction. So also hematocrit value is measured by the potassium level. Intracellular level of potassium is the biomarker of hematocrit value. The hematocrit value is always detected in sensitive cases, like if there is a higher value of hematocrit, first it is set, this value is set to normal level, then dried blood spot sampling technique will be useful or can be continued. So also there is issue of I already discussed that we are taking capillary blood volume in the dried blood spot sample technique. Capillary blood volume concentration is different from the venous conventional blood sampling. Conventional sampling is from the venous blood. The concentration of venous blood is different from the capillary concentration. Capillary blood consists of interstitial fluid, intracellular fluid, and also capillary blood consists of venous and arteriolar blood, mixture of arteriolar and venous blood, also mixture of interstitial fluid and intracellular fluid. So concentration is different, so there is difference between result of dried blood spot sample technique and venous blood sampling. So the results are always compared in clinical validation. Not so much difference, very little bit difference, but sometimes so much difference, so the clinical validation not okay, so we need to change the mm, validation method of dried blood spot if there is a problem in clinical validation. Also the filter paper matrix also affects the validation, like the filter paper normally used is Wattman 903. Also Wattman 903, another paper is also used as Alstrom 226. The Wattman 903 is purely made up of cellulose. The filter paper matrix also affects, like a study conducted on rifampicin assay by dried blood spot. In that study, it has been reported that the rifampicin was interacting with the filter paper matrix. Filter paper ferrikines rifampicin was making chelates with the ferrikines of the matrix of filter paper. So rifampicin recovery or extraction from the filter paper was too slow, and the results were not normal. So the method filter paper matrix was changed, like uh, filter paper matrix, how the filter paper was changed, like yeah, interaction between rifampicin and dried blood spot matrix was avoided using the complexing agents like ethylene diamine tetraacetic acid and deferoxyamine. Ethylene diamine tetraacetic acid is EDTA, and deferoxyamine are the chelating agents, complexing agents. Uh, these complexing agents were used in the matrix of filter paper to avoid chelation of rifampicin with the matrix of filter paper. So filter paper material also affects, is an influencing factor.